My name is Dr. Claudia Sonder, and I'm the president of the Napa Community Animal Response Team. And if you have a dog present to you at the companion animal shelter that is showing any signs that are abnormal, either abnormal position, seems like it's struggling to breathe, has an ocular discharge, cough, anything like that, there is a quick head-to-tail assessment that you can do on a dog to help you decide whether the dog needs to go in and have a veterinary exam or whether it can go straight into its cage. And often what I do with these kind of dogs is I'll make friends with them, make sure that we're on the same page, do a quick peek at their gums, push in, make sure that their capillary refill time is 1.5 seconds or less. I'm just going to use my thumb to pull up his hair, and then with that same thumb, push in over the canine, and you'll see that color goes away for a second and comes right back. That's called capillary refill time. And in a dog, under 1.5 seconds is normal. And you see that his gums are nice and bubblegum pink, and you can see that he's got good moisture. This is a sign of a very healthy dog. Take a look at their eyes, make sure there's no ocular discharge. I can take an assessment of hydration just by picking up skin and looking for skin tint over their shoulders is a great place to do that. And you can see his skin goes right back down. I'm watching his breathing, making a note of his respiratory rate. You can count the number of breaths that you see in a 10-second period and multiply that by 6. And then last but not least, if I can get the dog to stand, I can just put my hand on the inside of his thigh, and I can take his pulse right there. This is approximately the area where the femoral artery is. You can use your index finger and palpation finger, gentle pressure right in this area, and you'll feel a nice strong pulse. Normal pulse on a dog, 80 to 120. It's a great way to get a quick assessment of their pulse. And if you practice doing this at home, if you feel a nice steady pulse somewhere in the area of around 80 to 100 beats per minute, then that dog is pretty stable. And then one last thing to look for, is there any evidence that the dog's been having diarrhea or any evidence of infectious disease at all? And again, those would be evidence of nasal discharge, ocular discharge, coughing, difficulty breathing, or evidence of diarrhea. Those should be brought to the attention of the attending veterinarian.